Experiencing painful sex or pain during sex, what do you think could actually cause this? Do you think it can be treated? Well, we'll find out. Hi guys, it's me again, Dr. NG, and welcome back to my channel. If you're a returning subscriber, I'm glad to have you back from my heart. Then if you're a new subscriber, welcome to this channel. Okay, so this channel focuses on health and wellness as well as lifestyle content, but today we are going to be talking about wellness. Okay, and we have a very important topic today, just as the others that I've discussed previously, and it's something that you wouldn't want to miss. Today we are going to be talking about painful sex, also known as dysporunia. That's like the medical term for that. And listen attentively. This condition, or this symptom rather, is usually when somebody experiences persistent genital pain during or after sex. Okay, and this pain can actually be a superficial or deep pain. And aside from this physical pain and the effect it has, it also has some psychological and emotional impact on the individual's life. Who are those at risk of having painful sex or dysporunia? Okay, so people that are assigned females at birth are those at risk of having this, or those that usually have this. Well, it doesn't mean that people that are transgender females can't have painful sex, but it's commoner in those that are born females. Okay, and this can actually occur at any age. Okay, people in their reproductive ages and even postmenopausal women can do experience this symptom. What causes pain during sex? I'm going to divide this into disease conditions, okay, that cause this, and other factors as well. So we're going to start off with the disease conditions that could cause pain during sex. The first one would be a condition known as endometriosis, okay? So endometriosis is when, the tissue lining the inner parts of the uterus seems to appear in areas other than the uterus itself. Okay, so the uterus has like three tissue layers coming from the inside towards the outside. Okay, the first one would be the endometrium, okay, which is the inner lining, followed by the myometrium, which is the muscle layer, and the perimetrium, which is the outermost layer. So in this condition known as endometriosis, the inner lining actually appears in areas other than the uterus. And what are these areas where you would have the endometrium appear? The ovaries, the fallopian tube, the peritoneum, and less common areas where you can have the endometrium in this condition would be the lungs, the rectum, the bladder, and even the intestine. Okay, so this condition, aside from causing painful sex, can actually cause heavy menstrual bleeds. It can cause abdominal pains as well, and it can cause pain during urination. And the condition is a complex one that could have complications like infertility. The next cause of pain during sex would be a condition known as pelvic inflammatory disease. Okay, so this is an ascending infection usually arising from the vagina to the cervix and involving the uterus and even the fallopian tubes. So, and this condition is usually caused by organisms that are known to cause sexually transmitted infections like chlamydia and gonorrhea. It can occur after a miscarriage, pelvic surgery, or IUCD insertion, that is the intrauterine contraceptive device. So who are those at risk of PID, pelvic inflammatory disease? People that are sexually active, obviously. People that have multiple sexual partners are also at risk of this. What are the complications of the pelvic inflammatory disease? It can cause ectopic pregnancy. And what is ectopic pregnancy? That is when the fertilized ovum doesn't implant in the uterus and you find the baby growing or the fetus in areas other than the uterus, maybe the fallopian tube or even the ovaries. During sex, the sperm is released and passes through the vagina, the cervix, the uterus, and it keeps ascending on its long journey towards the fallopian tube, and the egg that is released during ovulation goes through the fallopian tube. That is where the fertilization occurs. The egg and the sperm, they join together to create or form a zygote, the fetus, that is the baby. And after fertilization occurs, the fertilized zygote usually goes down to implant inside the womb. So the baby continues growing in the womb. But in the case, this whole explanation is just like the normal thing that is meant to occur. But in the case of ectopic pregnancy, the baby doesn't grow in the womb. Instead, the baby grows in other areas, ectopic, outside the womb. It could grow in the fallopian tube, in the ovaries, and other rare areas that actually, in normal sense, it's not meant to happen. The next complication of pelvic inflammatory disease would be tubo-ovarian abscess. So tubo-ovarian, fallopian tube, and the ovaries. Abscess is basically a collection of pus. So tubo-ovarian abscess is when there is a collection of pus, which is significant of an infection in the fallopian tube and the ovaries, and this can cause infertility. The next point, that is the third disease condition that could cause painful sex, is fibroids. And fibroids are benign non-cancerous growths in the uterus. Fibroids can cause painful sex. It can cause heavy menstrual bleeds, irregular cycle. It can also cause, frequency and painful urination, as well as constipation. The fourth point would be adenomyosis, okay? So this is a disease condition where the inner lining of the uterus, we talked about it, something similar earlier in endometriosis. So, but this condition now is adenomyosis. The inner part of the uterus, which is the endometrium, is actually found in the muscular parts. So you can see the twist here. This particular condition has its own complications as well, because these are abnormal things that just happen to people and, tries to lead to complications that could be life-threatening. And it can cause painful sex. It can also cause irregular periods, bloating, abdominal pain, and also infertility. These are the 4 disease conditions or medical causes of painful sex. Now we are going to go into other factors that could cause painful sex. The first one would be injury or trauma to the vagina or vulva. This may be following childbirth, okay? Maybe you had a perineal tear or laceration, or you had an episiotomy. Episiotomy is basically like a surgical incision or cut that is given between the vaginal opening and the anus. So it just basically helps to widen the birth canal, that is the vagina, so that the baby's head and body could pass through. So when you had the childbirth, okay, or you had like a perineal tear or episiotomy that was done, and you don't really wait for the wound to heal and you start having sex, soon after that, you could have pain during sex. The next one will be some medications known as antidepressants, okay? This could include sertraline, fluoxetine, as well as antihypertensives like beta blockers. They can actually, reduce sexual urge and, can make you have pain during sex. During menopause, the estrogen level drops and, women in this category tend to have vaginal dryness and can actually experience pain during sex. Next one would be people with history of sexual abuse, okay? Due to the, previous traumatic experience of that, the initial pain they had could actually lead to fear of another pain occurring during sex. So that is why, they tend to have like the pelvic muscles tend to tighten and, they may experience pain due to that fear. It's more of like both physical and psychological impacts playing a role in this aspect that we're talking about. Last but not the least would be stress. Stress actually causes a lot of harm to our bodies than we do imagine. So when you're stressed out, you're not relaxed, your nerves are not calm. So what happens here is that the pelvic muscles tends to tighten and the person finds it difficult to enjoy a particular sexual activity. So you can experience painful sex if you're stressed out. What is the treatment of painful sex? The first important way to tackle this problem would be treating the underlying cause, that is especially disease conditions that cause painful sex. So, I listed a couple of them and I explained them. So when you have either of these disease conditions, it is advised to meet your healthcare provider or gynecologist to help address this problem the right way. Then other factors that could cause it, you can put in some effort to try to stop them, try to avoid things that could cause it. So if you're on antidepressants that I mentioned earlier or antihypertensives, maybe prescribed by your psychiatrist or your general physician, so you need them to make some adjustments to these drugs, I think that would be the right thing to do, not stopping them, because you actually need them for the other medical problems that you're being managed for. Also, you could use water or silicone based lubricants, during sex to help with easy penetration so that you would feel relaxed and not experience pain. Then people that are menopausal, you can go to your general physician or a gynecologist to prescribe, estrogen creams or tablets that could help with the vaginal dryness and, help with lubrication of the vagina during sex. We talked about stress being a factor. So, finding time to ease off stress, calm your nerves before sex. Maybe you can take a warm bath, feel relaxed. Then lastly, you can take some pain relievers, to help with the pain. But you know that this is actually temporary, because if you don't address the underlying cause of the pain, well, you might get some temporary relief from the pain reliever, but it will come back again. The pain would occur again. So you address what is causing the pain, then the pain disappears. That brings us to the end of this video. I hope it was informative. I hope it was very helpful. Please don't forget to subscribe to my channel to get more updates on health videos, and like and comment as well. Please comment, very important to me, okay? Areas you need clarifications, and I will address every single one of them. I will see you in my next one. Bye.